I'm David Rotland. I'm a cardiologist. I'm the director of the Division of Cardiovascular Medicine at UAMS. The heart has 4 valves: the aortic valve, the mitral valve, the pulmonic valve, and the tricuspid valve.
My name is Gareth Tobler. I'm a cardiothoracic surgeon at UAMS. The heart valves function as a one-way valve. They allow the heart to push blood through in one direction while preventing blood from falling back or going back in the other direction. When a valve becomes unhealthy, there are 2 things that can happen typically. One is stenosis, meaning that it becomes narrowed and it becomes harder for the heart to get blood through that valve. Or 2, it becomes regurgitant, meaning that it leaks. Blood falls back, and so the heart spends a lot of time pumping the same blood through that valve because it's leaking back into the heart or leaking back through the valve. Heart valve disease is most common in the left-sided valves, the mitral valve and the aortic valve. If you think about causes of these valve diseases, most of them are degenerative, meaning that they just happen to certain people. Some are a result of other diseases, and then there are some cases where it's infected. There are non-surgical treatments for heart valve disease, including adjustment of medications, and patients can be treated quite successfully for a period of time. At some point, they reach the point where the valve needs to be repaired or replaced. There are different options with regard to the mitral valve and the aortic valve. Let's talk about the mitral valve for a second. In mitral valve disease, we try to repair every valve we can. There is no perfect prosthesis, and every prosthesis is not as good as your native valve if it's in good shape. And if we can repair your native valve without replacing it, then that is the best option. So if there's for example, a central portion of the valve that is redundant or floppy, and the cords that hold it in place are torn, then we can sometimes cut out that central portion, put the valve back together, and make it work the way it's supposed to. If we have to replace the valve, then we have 2 categories of choices. We have a mechanical valve and we have tissue valves. When we're talking about the aortic valve, there are a few more options. We're happy to see any patient who has valvular heart disease for an opinion as to whether they need surgery, or for a second opinion if they're questioning whether they're a candidate for surgery or when would be the best time to have surgery.
We do all of that at UAMS. Actually, we're one of the handful of places in the country where we can blow up a balloon to open up the mitral valve, and we have cardiac surgeons that are superb, and they can repair or replace any heart valves that need repair or replacement.